difficult to gauge if and when a child might be battling with mental health issues. But there are some signs parents and caregivers should be aware of, and here to shed light on some of those signs and also the next steps to take in terms of treatment is clinical social worker and telehealth committee member at Kennedy Krieger Institute, Anna Ditkoff Dorsey. Good morning to you.
Good morning.
So this is Children's Mental Health Awareness Week, another good reason to be talking about this, but highlight some of the importance of considering mental health for children. We talk about it often for adults. What about for children?
Oh, it's so important for children. Just like anyone else, they can deal with anxiety, depression, and especially during the pandemic, they're dealing with so much stress, uncertainty, and isolation. And if we give them the tools now while they're young, they're just going to do so much better as they get older and become adults.
So how do parents spot what's going on? Because we are in the middle of the pandemic. So maybe they're just, upset because they're not seeing friends, or maybe, there's so much that you don't know whether there's some issue or if this is just a symptom of being stuck at home.
Absolutely. And I think really looking at changes in behavior, teens can be irritable in the best of situations, but really seeing an increased irritability is a sign of depression for especially teenagers and adolescents. If they're not enjoying activities that they used to enjoy, a kid that doesn't want to play video games suddenly when that was their favorite thing to do might be something to keep an eye on. If they seem to be very negative, if they're having trouble sleeping or having thoughts that they don't feel like they can control, those are all things that you can look out for.
And if you notice any of those, what's the next step as a parent?
Definitely take it seriously. During the pandemic, there's been some evidence of increased self-harm behaviors and even suicidality with our young adults, teens, and even tweens. So I think it's important to take it seriously and to reach out for help with a licensed professional. Go to kennedykrieger.org, or if you think that there's a real risk, immediate risk, please call 911. It's an emergency. And
it's heartbreaking to hear you talk about that, but we've done so many stories in recent months about seeing some of what you're talking about. Talk about resources for parents. Where do they go to get more information, to try to maybe even be preventive with their kids?
Absolutely. I do think kennedykrieger.org is a great resource. We've got a lot of different programs that can help, with behavioral issues, with emotional issues. But there's also, go to your school counselors, go to teachers. They have a lot of great resources as well. And then there's just a lot of, things out there for people, even apps that can help with calming and relaxation.
So when we say preventative also, is there such a thing as preventative measures to keep your kids from getting to a point of depression or anxiety, or is there such a thing?
Well, I think continuing to check in with our kids, trying to make sure that they're as unisolated as possible in this situation. Yeah. I think one thing we forget about is we know they're separated from their peers, but what about those adults in the school that used to be such a big factor for them? The English teacher that they could drop in and talk to if they were upset, or the art teacher who would make sure they were okay. They're missing out on those people a lot. So really bringing in other caring adults to be part of your children's lives is really important.
That makes so much sense. Okay, if it gets to the point of kids needing treatment, what types of treatment are we talking about? Because maybe some parents say, you know what, I don't want to medicate my kid from now till eternity. Are those the only options?
Oh, absolutely not. Medication is very helpful for some kids, but there's so many therapy options. And it really can give those kids that boost they need, just learning some coping skills, having someone to talk to. We all need someone to talk to about our problems. And sometimes it's hard to talk to your parents about being frustrated with your parents.
Right. Very true. All good information. Anna, thank you so much. We appreciate it.